Cardiovascular home care is unique in that it offers some specialty programs that address issues for seniors that other home care agencies don't really address. And primarily the three programs are the cardiac, which is the bread and butter of the agency, and then the orthopedic program, which specializes in rehabilitation, and then also our Safe Choices program, which specializes in senior care planning and safety issues for adult people trying to take care of their elderly parents.
CardioVascular home care, a home care agency that is run by nurses, which is very important because they really care.
And it's flexible. You case manage your patients, so you set your schedule.
I chose to work here because as a professional I'm committed to excellence, and I wanted an agency that shared that value and hired other professionals that were as committed to the quality of care.
You have to manage critical care patients that we're trying to keep out of the hospital.
The best thing about working at Cardiovascular Home Care in terms of rewards is being able to serve other people.
It's an agency that has a lot of heart. They really care about their patients and their patients' needs.
It's very professional. You meet the family, you meet the patients, you know about their disease process, and then you develop a rapport with the patient and their family, and you almost become a family member.
They're always very thankful and appreciative, and that makes it really nice to work in an area where you get that kind of gratitude for your efforts.
The nurses are of the highest caliber, so you can be confident of that kind of care that your particular patient's receiving. And then the social work department cannot be topped. So it just makes for a very strong team.
Since it employs its social workers on a full-time basis with benefits, follow-up is critical to making sure that we don't just identify the problems, but that we fix them. So that's one of the things that the social services department here at Cardiovascular does that's not done anywhere else in the market.
We've got just the best team of staff that there is, I believe.
There is great integrity. There is trust in us as professionals to evaluate that patient and set their plan of care according to that patient's needs.
And I think that the trust and the respect in this community from the physicians makes this agency outstanding.
My grandmother used to always say that you can get more flies with honey than you can vinegar, and the hospital setting is definitely one where people are more forced to comply with what you want. When you're in the home setting, really test your ability to be a motivator and an educator to get people to do what they need to do to help them to get better.
The satisfaction comes in seeing just a patient feeling so much better about their quality of life, feeling so much better about themselves. A lot of times what I've heard is, "You've given me hope." So all of those things make being a therapist in a patient's home working towards their goals really rewarding.
Cardiovascular offers so many opportunities to be involved in people's lives in such a personal way. When you go to give, you receive so much.
There's resources throughout the whole company for you, and there is an orientation period. You're not thrown out there. We believe in trying to retain our nurses and teach them from the beginning.
I love the balance that it gives me in my life.
The reason that we chose the Happy Nurses brand is because we find that there's a lot of people out there who aren't satisfied with the opportunities in the medical careers that they have, that somehow it's just lost sight of the patient. And we offer you a chance to be happy by joining an agency that cares about the patient. Unlike a lot of agencies, our disciplines are not spread throughout the Metroplex. They get targeted territories that make it easier for them to maximize the patients that they see. We're an established 15-year-old agency that continues to grow in response to the growing demographics and changing dynamics of the medical field and our patients' needs. We provide unique support for our staff, whether it's in the form of training, equipment and supplies, or a competitive salary and benefits. If you're a social worker with at least 1 year of hospital or other medical experience, we'd be interested in showing you how you can have the opportunity to make a difference in your patients' lives. If you're an occupational therapist who's looking to make a difference in your patients' lives, or a physical therapist that's looking for new opportunities to help a patient in a more patient-focused setting, we'd like to talk to you. If you're a nurse with 2 to 5 years experience in a cardiovascular background, such as ICU, CCU, telemetry, or other high-level cardio background, we'd like to speak with you and see if we can offer you the chance to have a more flexible schedule, a better family life, and still achieve your professional goals. It's the opportunity to join an agency that will take care of you the way we expect you to take care of our patients. If you're interested in our agency, please check out our jobs here on jobbing.com, or for more information, click on www.happynurses.info or call us at 817-847-8888, extension 121.